Good morning. Welcome back to school today. Last week we had scheduled a couple of insurance meetings across the district to talk about the changes in our plans. We obviously didn't get a chance to do that. So right now taping this and holding the phone is Drew Bogard from FTJ, who's going to talk about our MUHP plans. I know that's a lot of acronyms, but it's the consortium which we're in is MUHP. Forrest T. Jones, FTJ, they are the administrator, and they will be here all week on campus. You can go online and log all this yourself without talking to FTJ, but they're here for any of your questions. So, Drew, what can you tell us about these plans?
Not sure if it something came up to log in. Did it?
We're good.
We still live? Good.
Yeah.
Well, and thank you for the opportunity. And as Dr. Boyer said, the key to this is that we'll not try to make this be a completely comprehensive summary. It's going to be kind of high level, knowing that we'll be in the district for the remainder of the week. You'll have access to us in all the buildings to come ask us more specific questions. But in a nutshell, basically two things that I'd like to summarize today is the transition on the health insurance to having Cigna administer the plans, and then also the Cigna dental transition as well. So with respect to the health insurance plans, the key to this is to understand that much more is staying the same than is actually changing. And there are some pretty significant improvements that we want everybody to be aware of with the transition to Cigna. So when I talk about things being the same, we're talking about the change being an administrative function behind the scenes where who the MUHP pays to process the claim and whose network we access is the thing that's changing. The MUHP is still the same. The plans are very similar to what we've offered in the past. You've still got Forrest T. Jones and myself and all the other enrollers. The MUHP part of it is consistent. The online enrollment, the FTJ Connect, all of those things are the same. What's different is actually who's processing the claims behind the scenes. So starting 7/1, starting July 1st, we're going to have to be aware that even though the benefits are similar or exactly the same in most cases, the network that we're using is going to transition to Cigna. So before we talk about the plans just a little bit, I want to make a really important point about the network. Now that we are using Cigna, there are some pretty significant improvements to the HMO. And Cigna doesn't technically offer an HMO in all parts of the state of Missouri. So what we've got is basically an HMO clone is what I like to call it. And you'll see on the screen when you look at the plans, the OAPN, and again we're back to alphabet soup and it's a little bit different, but that is the HMO replacement. The benefits on that plan are exactly 100% identical to the current HMO benefits. So it still has a $2,000 worst case scenario for your out-of-pocket annual maximum. And most things that you do throughout the year when you're using your health insurance are still covered by a copay. The significant improvement on that is that because this is no longer an HMO, it does not have the network restrictions that the current Anthem HMO has. And that's a very, very, very significant improvement. So technically this HMO clone, this OAPN, is actually a $0 deductible PPO plan. So it's no different than the PPO 3500 next to it, except in terms of network access. The difference is that it's a $0 deductible with the same benefits that you currently have on the HMO. And because it is built on a PPO platform now, that means that you have access to network providers throughout the entire state, throughout the entire nation, and actually worldwide. So some of those things that were a problem or somewhat limiting on the current HMO, finding network providers in Arkansas, all of those things are a thing of the past with this improved OAPN plan. So you can find network providers throughout the entire state, over in the Kansas City area, throughout the entire country, and also throughout actually the entire world. So there's no concerns when you're traveling on vacation, or if you've got a child that goes to college out of state, they're going to be able to find network providers on this new OAPN plan. And then with respect to all of the plans, there's another pretty significant improvement with the transition to Cigna, in that for the first time that I'm aware of in Southwest Missouri and Southeast Missouri, we're going to be able to offer plans where the employee has the choice of using network providers with both Cox and Mercy.
Drew, let me just stop you right there.
Yep.
One of the questions that we've had come up multiple times is how do we designate, how will we designate what network we want to be a part of? Because you can't be a part of both. You have to choose, correct?
You choose at the time of service. You actually have complete freedom to use any of the providers through the Mercy system or the Cox system. The Mercy system is contracted directly with Cigna. With the Cox arrangement, the MEUHP has a special contracting arrangement with Cox directly to allow all of the MEUHP members to have access to Cox providers. So it's a little tricky when you're looking for providers on the Cigna portal. You're not going to see the Cox providers, but you'll have to have faith that all of the Cox providers are still in network. When you make a phone call to a Cox provider, if you ask them whether they take Cigna insurance, the answer is more than likely going to be no. What you have to remind them is that you've got a direct contract with Cigna through the MEUHP. That's the key. So the contract is in place. At the employee level, every single time you're seeking service, you have the choice of using a Cox or a Mercy provider. And that's a huge improvement to what we've had to offer in the past. It was always Hatfield and McCoy's, one or the other, and now the employee has the choice.
Okay, so I want to make sure on this. You could actually go to Cox Hospital in Springfield for a child who breaks an arm, and then later in the same year you could go to St. John's for a different...
Absolutely.
Okay.
Yep.
So
it is not a choice that you have to make at any global level. It's actually an individual choice. Each time you're receiving services when you're using your health insurance, you have the liberty to choose Cox providers or Mercy providers.
okay, excellent.
So that's a big improvement. With respect to the benefits and the plans, hopefully, other than the different acronym on the OAPN, the HMO replacement, a lot of those plans should look exactly the same. And that was one of the keys. We knew that we were changing the administrative services behind the scenes, so it was very important for the MEUHP board to keep as much of the rest of it exactly the same. So even though these are now going to be Cigna plans starting July 1st, they have the exact same benefits as the current plans, with the exception of the PPO 3500. We've replaced the PPO value in the past that very few people were enrolled in with the PPO 3500. So that is a new plan, but the rest of them, for all of the employees, if you choose the same plan that you are currently on, you will not have to learn a new deductible, a new copay, any new coinsurance. The benefits are identical to the current plans. So that was really important. And that always brings up the question of, okay, what happens to my deductibles and my out-of-pocket maximum whenever you're transitioning from one insurance network to another? And they were adamant that the employees and the members of the MEUHP be made whole, and you will not be compromised on deductible or out-of-pocket credit. Any deductible or out-of-pocket that you've satisfied currently on your Anthem plan will move with you into your Cigna plan. So you will get full credit for any deductible and out-of-pocket that you've currently satisfied in the first half of this calendar year. Remember that all those deductibles and out-of-pocket maximums are going to reset January 1st, just like they always do, but you will get full credit for anything that you've satisfied in this calendar year. And that applies regardless of which plan you move from. So if you are somebody that was on the HMO and for whatever reason you're going to transition over to the HSA, your out-of-pocket maximum would go with you. So that was another important consideration. Some of the things with the HSA that have come up in our conversations, it's really important to understand that, again, in an effort to keep everything as much the same as possible, the Preventative RX program that was a part of the HSAs is going to continue with Cigna. Cigna and Anthem have slightly different lists, but they cover the exact same conditions. So both lists will have the same conditions covered. The medications, actually, there's a tremendous amount of overlap, but in some cases there might be a medication that was on the Anthem free list that's not on the Cigna list, or vice versa. The Cigna list is actually something like 60 medications longer. It's an improved list. Bottom line is that all of the conditions, so if you were taking a diabetes medication that is on the Anthem free list, if you're somebody on the HSA, there will be a whole list of diabetes medications listed on the Cigna Preventive Free list as well. So that was really important.
Hey, Drew, let's stop right there. That's
Yep.
10 minutes. Let's call that part one.
Okay.
And we'll get part two going here with a different set of topics and questions.
Yep.